Hi, welcome back to the channel. I'm Dr. Carla, a pelvic floor physical therapist. I want to talk to you today about continuing on our journey of providing free information with using evidence-based proven strategies to help our overall health and well-being. Specifically, I'm going to focus on today pelvic pain. Pelvic pain can be caused by many different factors. Number one, this does not replace medical advice. If you're having pelvic pain, please follow up with your primary care physician's office to determine if there is a potential cause. It could be a urinary tract infection. It can be something else that's going on in one of the pelvic or abdominal organs. Once you get cleared and you're still having pelvic pain, and it can include pain during sexual activity. It could include pain just sitting at your desk, for example. It could be occurring while you're sitting in a car for a prolonged period of time. Nonetheless, number one, get medically cleared to make sure that you are able to participate in an exercise program. Number two, I'm going to talk about just to demonstrate a few exercises to begin your journey. I highly recommend using a TheraBall exercise ball. If you feel uncomfortable sitting on a ball, put yourself in a corner so that you have walls on both sides that you can use your fingertips to balance yourself. And an exercise you can start with is simply what I'm doing here, is getting comfortable on the ball and bouncing. Second exercise that helps to improve blood flow, which helps to promote healing, especially if you're having issues with tightness that happens to be the cause of your pelvic pain. Another exercise you can do is called pelvic circles. Recommend doing 10 to 20 of these in one direction and then 10 to 20 in another direction. And then a third exercise that can begin your journey on healing and reducing that pelvic pain is a pelvic tilt. Sitting nice and tall, lifting the head and the heart, and then doing the opposite, somewhat slumping and tucking that tailbone underneath your buttocks, and then lifting the tailbone up and then down. Again, 10 to 20 of these pelvic tilts can also help begin your journey of reducing pelvic pain if we determine pelvic pain is being caused by some restricted movement in the pelvis, basically some tight pelvic floor muscle. I will include some links in the description below if you're interested in checking out the research articles that provide evidence-proven strategies to support the use of pelvic floor therapy to help to reduce pelvic pain and to improve overall quality of life.